Hello. Hello, class.
Hello, Ma. We can hear you now. You went off for a while.
Yes, it went off for a while. Now we are back. I said labor, it can occur from 34 weeks to 40 weeks or 41 weeks plus 3 days, normal labor. But premature labor, which can also occur from 28 weeks to 34 weeks. That is regarding But this morning we are talking about normal labor that occur from 36 weeks, 35, 36 weeks to 41 weeks plus 3 days. Now, we talk of labor at term pregnancy, but there are some women, pregnant women at term, which cannot go to labor room. There are some women, when they are term, they cannot go to labor room. What type of women cannot go to labor room? I want to share my screen with you. Yes. Can we? Hello?
Hi,
Hello?
we can hear you.
Yes, okay. Now, I said during labor, we have some women who cannot go to labor room. They are pregnant, the pregnancy is term, but they cannot go to labor room. What type of women are these? There are women with contracted pelvis. Their pelvis is like a man's pelvis. The baby's head cannot go through it. So such women, their doctor will tell them that you have a contracted pelvis, madam. We have to take this baby out by cesarean section. Another type of woman that cannot go into labor room is a woman with big baby, but normal pelvis. This woman, she has normal gynecoid pelvis, but her baby is bigger than the pelvic canal. So that woman, the doctor will say, I will offer you cesarean section. There are some women too, their baby can be malpositioned when they have an abnormal position. Maybe the baby is lying oblique, or the baby is just sitting on the pelvis, or complicated breech presentation. For such positioning, the doctor will offer the woman cesarean section. Sometimes there can be multiple babies. You can have twin, you can have
Hello, Matron.
When a woman has high blood pressure, at time, the doctor will allow such woman to go into labor. The woman is better delivered by cesarean section. Now, when a woman has established labor, when a woman is now in labor, it is good to know that sometimes at the end of the labor, at second stage, the woman can deliver by herself. That we call spontaneous vaginal. Sometimes when the baby is almost out, the baby can be caught in between. At that stage, the doctor can use forceps to help the baby to come out. Sometimes, the baby might be very close to the perineum of the woman. At that stage, the woman, maybe she is now tired, she cannot push. Then the doctor can offer to assist the woman by using vacuum to pull the baby out. But sometimes it can also can we hear me? Can we hear me?
Yes, ma'am, we can hear you, but you're going off and on.
We can hear you, but it's really
the network. I'm sorry.
The network is bad.
It's really very bad.
Okay, let me round up that one. I said it can also happen that when the woman is fully dilated, you can see the baby's head, and somehow the labor will be obstructed. In such a case, the doctor will have to terminate that labor with cesarean section. It can happen. The woman I'm sorry, it's network. So I said sometimes the woman will be fully dilated, the cervix will be fully dilated, but the baby will be cut up and will not be delivered because there is obstruction somewhere. So that's why sometimes you see a woman, she has gone through labor, cervix is fully dilated, but there is obstruction. Baby cannot come out. At that stage, the doctor will offer cesarean section. Now, haven't discussed that, let's go to signs of labor. What are the signs? When your pregnancy is term and you begin to have lower abdominal pain or lower back pain, or the two can run together, lower back pain, lower abdominal pain, or you begin lower back pain or lower abdominal pain, and you feel tightening around your tummy that is contracting and relaxing, or you feel your water breaks. You feel water just pouring down from your private parts. Or when you go to the toilet, you wee-wee and you clean, and you can see on your pad or your toilet roll a thick mucus stained with blood. These are signs of labor. These are signs of labor. When you see all these signs, you can just hold on a bit and not rush.
Hello, ma. Matron. Hello, ma.
Hello, ma. I can't hear anything, no.
It's the same for everybody.
Okay, sorry.
As well.
I said when. I said when can we? I said hello. Can we hear me?
Now we can. Before,
yes,
no.
Now, okay. Yes.
We can do
now, I said, when do we go to the hospital? When can you go to the hospital?
You will have to tell us because we didn't hear it when you said it.
Okay. I said, when you start having contractions, that is lasting between 45 minutes to, between 45 seconds to 60 seconds. And it's occurring 3 times in 10 minutes. When you have to go to the hospital is when your contraction, when you start feeling it within 45 to 60 seconds, and it's occurring 3 times in 10 minutes, and you have seen the show. This is the time to pack your things and go to the hospital. The hospital, taken to the labor room, the midwife or the doctor will, once you start labor,
Hello, please, we're not getting the message. Oh, I'm not. It keeps breaking at points where you want to give us.
I'm so sorry. I'm so sorry. When you get to the, like I said when the time to get to the hospital is when your contraction, you start feeling it three times in 10 minutes. And each contraction lasts 45 to 60 seconds. You go to the hospital. When you get to the hospital, the doctor will, or the midwife will take you to the labor room. In the labor room, the doctor or the midwife will do what is called vaginal examination for you. What do they want to find? What are they looking for? They want to check your cervix, the state of your cervix, and want to see where your baby's head is lying. Once you start labor, your cervix will become soft. And once your cervix becomes soft, the cervix that is long before, that is the neck of your womb, will now begin to retract. The cervix will now begin to retract. The cervix that is long will now begin to be taken up and disappear into the body of your uterus. That is what we want to check. When we check you, when you come at that stage, your cervix may be halfway taken up. Your cervix may have been dilated. Usually when you come at that stage, maybe your cervix is like 4 cm. When the cervix is like 4 cm, we call that stage first stage and at latent phase. First stage of labor, when you are 4 cm dilated. First stage of labor and at latent phase. There are two phases at first stage of labor. The first phase is latent phase. The second phase is active phase. The latent phase, at this phase, you can move around. You can take any position that you want. And at this stage, when you are 4 cm, some women, they don't want pain during labor. They want painless labor. This is the time that the doctor can come and give you what is called epidural. He'll give you an injection at your back, and that injection will be topped up every hour to make this injection will be given to you at your back to make sure you don't have pain during labor. And those who want to go through their labor without taking pain-free injection, then they go through it without taking that injection. Now, at the onset of once you get to like 10 cm, While you are in labor, in the active phase, your baby will be monitored. There's some things we use to, there's some instruments we use to monitor the baby while you are in labor. Sometimes we come with Sonicade. You will see that thing that will put gel on your tummy and we press it on the tummy is to listen to your baby's heartbeat. We have another one in the labor room that would tie like a band round your abdomen, round your body. One at the top, one below your abdomen. It is to monitor your baby's heartbeat and monitor your contractions. And while you are doing that, for some people at this first stage, their contraction may be weak. When the contraction is weak, then we set a line for you. Infusion, put one injection in the infusion to help you. We call it augmentation, to help the weak contraction that is forming to be strong. Sometimes some women, they are term, but they don't go into labor like that until they are induced. It's the same injection we use to induce that we use to augment. It is to help this woman to be able to contract and be able to once the woman reaches the second stage, when the cervix reaches 10 cm, during this first stage, the midwife or the doctor will come to you and do what is called vaginal examination for you every 3 hours to monitor how the cervix is responding to the contraction. Once you get to like 5 cm, if your water has not broken, the midwife will come and then help you to break your water. When she helps you to break your water, the water will once the membrane is broken and the water flows out, your contraction will be stronger. Most labor is done within the first stage of the labor. That is when we help you, when you have weak contraction, to make your contraction stronger, either by giving you injection in the fluid or by breaking your water. And by the time your cervix open up to 10 cm, at 10 cm, the cervix that is long would have been taken up completely. And then we can feel your baby's head. We can see your baby's head. That is the beginning of second stage. Second stage is when your baby is pushed out. What do you do when you get to second stage? At second stage, you will feel the urge to push. Without being told, you will be feeling the urge to push, as if there's something under you and you want to push it out. And how do you do this? You breathe not be effective. If you shout, your pushing will not be effective. You need to close your mouth and take a deep breath. and then push down. When you do that, because the cervix is no longer there, it is your baby's head is just in the vagina. You are able to push it out. And sometimes when your vagina, the vulva is tight. Sometimes some women have tight vulva. When the vulva is tight, the midwife or the doctor can give you a small cut. It is called episiotomy. Once that cut is given, you can now push your baby, and the baby's head will escape through the vulva, and your baby can be delivered at this stage. Once your baby is delivered, your baby will be pulled over your abdomen for you to start bonding and cuddling your baby. You'll be separated from the baby by the cutting of the placenta. This is the end of the second stage, when your baby is born. Second stage, your baby is born. At second stage, your baby is born, and you cuddle your baby. And this brings us to the beginning of the third stage. At the beginning of the third stage, this is when the placenta has to come out. Until the placenta comes out, the labor is not complete. Now, you will be asked to push a little too, or to cough a little, and then we'll pull the placenta out and clean you up, and then the end of the third stage. The third stage is when the placenta is delivered. After the placenta is delivered, if you have a cut, it will be sutured. A local anesthesia will be given to you, and the episiotomy will be sutured, and you will be cleaned up, and then you will be taken to your bed properly. Now, this brings us to the end of labor. But let's note this. If you have premature labor between 28 weeks and 34 weeks, once your baby is delivered, your baby will be taken to intensive care unit for babies. It's called nursery. If you deliver or have labor from 28 weeks to 34 weeks, your baby, once delivered, will be taken to intensive care unit where premature baby are taken care of. And from there, your baby will be taken care of by the nurses. They will ask you to bring breast milk to feed your baby. And once your baby gets to good weight, like 1.5, 1.7, that is when, if your baby comes around at about 28 weeks, the baby will stay in the incubator till baby gets to about 1.5, 1.6, or 1.2 or 2 kg before your baby can be released to you. But if you have your baby around 34 weeks, 32 weeks, and your baby is up to 2 kg, your baby may not stay long in the incubator before the baby is given to you. Now, we come to the end of today's topic. I want to listen to our questions. I'm sorry the internet was breaking and we could not pull through at a stretch.